If you've ever wondered, should I be worried about prostate cancer? Or what if they do a test and find something terrible? I want you to take a breath and stay with me. Because for many men, the scariest part is not the test itself, but the uncertainty. So today, I'm going to walk you through prostate cancer diagnosis in a simple and honest way that you can understand. With this, we can understand what the PSA test actually does, who is at risk, and how early detection can make a life-changing difference. So my name is Mr Sotonye Tolofari. I'm a consultant urological surgeon based in Manchester. A big part of what I do is help men understand their conditions early, especially when it comes to things such as prostate cancer. So let's start with the question that everyone always asks me. Men, if you don't even know what the prostate does, listen to this. When I talk about prostate cancer diagnosis, I always like to start with the basics, because once you understand the prostate, the rest makes much more sense. So essentially, when looking at the anatomy of the prostate is a small gland that sits just underneath your bladder and actually wraps around the tube that you wee through, known as your urethra. The main function of the prostate is to produce semen and seminal fluid, which is what you see in addition to your sperm when you ejaculate. Here's a simple analogy that I give my patients. The prostate is like a small ring around a pipe, and that pipe is your urethra, essentially the tube that you wee through. If that ring becomes enlarged, inflamed, infected, or develops some sort of issue, it's going to affect how your urine flows through that pipe. Now, it's important to mention that not every single problem with the prostate is prostate cancer. Common prostate-related issues might include benign enlargement, which is not cancer. This is also known as BPH, benign prostatic hypertrophy. Inflammation or infection of the prostate, which is also known as prostatitis, and prostate cancer, which of course we're going to focus on today. One of the main reasons that prostate cancer can be tricky or difficult to diagnose is that for many men in the early stages, it may have no symptoms whatsoever. This is why early diagnosis is really important. People often ask me what they should do with a high PSA test result. Here's exactly what you need to know. A high PSA test in itself is not necessarily a verdict of cancer. This is a misunderstanding and often scares a lot of men. Okay, so let's clear up one of the biggest misconceptions. The PSA test in itself, in isolation, is not necessarily a yes or a no for cancer. It's much more nuanced than that, and the PSA test in itself is best thought of as a clue, really, as whether cancer may be underlying. So PSA stands for prostate-specific antigen. This essentially is a protein that's produced by anyone who has a prostate. Now, we can measure this protein in the blood. If the PSA test is high, it doesn't necessarily mean there's prostate cancer there, but it means that your prostate is producing more PSA than we would expect. But that in isolation doesn't automatically mean that you have prostate cancer. So I often explain it like this. The PSA is a little bit like a smoke alarm. If the alarm goes off, it doesn't necessarily mean that there's a fire, but it means something needs attention. An elevated PSA test can happen for several reasons, which include prostate cancer, benign prostate enlargement or BPH, inflammation or infection, something such as prostatitis. In some cases, recent ejaculation. In some cases, you may have had recent instrumentation near your prostate. For example, if you've had a urethral catheter inserted or a recent camera test into your bladder. So when the PSA comes back as high, we don't need to panic straight away, but we know at that point there's some sort of indicator that suggests there may be an abnormality within the prostate of some sort. For the most part, the PSA test is the first part of a journey to a potential diagnosis of an abnormality in your prostate. If you have a father or a brother with prostate cancer, you need to hear this. This is actually one of the most important parts of the conversation, because we know that many of our discussions around prostate cancer diagnosis are on the basis of your understanding of your own risk factors. The biggest known risk factors in prostate cancer include the following. Age. First of all, we know that as you get older, particularly as you get over the age of 50, your risk of prostate cancer significantly increases. Family history. So if you've had a first-degree relative, so that is a father or a brother, who's had prostate cancer diagnosed under the age of 55, we know that is significant, and that can place you at a higher risk of prostate cancer. Ethnicity. So we know that Afro-Caribbean men are twice as likely to develop prostate cancer as other ethnic groups. And unfortunately, for that cohort of men, we know that prostate cancer can be much more aggressive. Genetics. So this goes hand in hand with family history, but we know that there are some inherited genes that link very closely with breast, prostate, and ovarian cancer. So as discussed before, if you've got a father or a brother who's had prostate cancer under the age of 55, that is significant. If you've had a mother or a sister who's had breast or ovarian cancer under the age of 50, again, that is very significant. Now, all of these risk factors really need to be taken with a pinch of salt. So I know many men who would say, well, no one in my family's had prostate cancer or any other cancer, so I definitely won't get a cancer. Now, that's not quite true. we still know that many men may develop a cancer with no family history whatsoever. So in contrast to that, I also get other men that come to see me to say, well, my dad had prostate cancer, so I'm definitely going to get prostate cancer. Now, in actual fact, although yes, your risk might be higher, you still may never develop prostate cancer yourself. Are you waiting for symptoms of prostate cancer? That can often be a big mistake. In general, many men come to see me, usually around the age of 50 or beyond, to discuss their prostate cancer risk. But if you've got certain risk factors, for example, if you're Black or Afro-Caribbean, if you have a strong family history, you've got known genetic risk factors, then we'd often suggest that conversation happens a little bit earlier, around the age of 45 or so. Now, as we've discussed already, many men with prostate cancer may have no symptoms whatsoever. So it's really important that you understand your risk. You can seek help from a local urologist or from your GP and have those conversations early before problems arise. That being said, some symptoms of prostate cancer might include symptoms of an enlarged prostate, which may be so needing to urinate more often, particularly at night. You might notice there's problems with your urinary flow. You might notice it's difficult to start urination. You might feel like your bladder doesn't fully empty. You might notice that there's blood in your urine or in your semen. And then finally, in particularly advanced scenarios where there's prostate cancer that is spread, we know that prostate cancer spreads to the bones, and it may well be that you start getting bony pains all over your body, particularly in areas such as your spine. So it's important that if you do have some of these symptoms, you don't panic. They may well not be in relation to prostate cancer, and there may just be signs of an enlarged prostate, which could be entirely benign and very, very common. The only symptom which is a cause for concern is if you've had blood in the urine, because you know about 25% of men who've had blood in the urine will have a degree of cancer somewhere in their urinary tract. So that is something we do take very seriously. A high PSA does not mean that your life is over. So this is a moment that often causes a lot of anxiety. You may see a result that you've had done with your GP or with your local urologist. You see it's a high PSA, and automatically you start worrying and thinking the worst. Just to reassure you at the outset, the PSA test in itself is a signal that we need to do some investigations, not necessarily a diagnosis. What may happen next after a high PSA result? So first of all, in some cases, we do repeat the test. So if we're a bit unsure whether there may have been evidence of infection, then the result may be abnormal for another reason, we may repeat it to confirm that it is actually high. Clinical assessment. Your doctor may call to see you, they may want to examine you, ask about if you've had any problems with your urination or any problems with recent infection or any other issues. Prostate examination. In some cases, your doctor may offer you a digital rectal examination, which may be recommended to assess the size and the consistency of the prostate. Imaging, such as an MRI scan. So the MRI scan itself is hugely accurate now at detecting prostate cancer or abnormalities within the prostate, up to about 90% accuracy. So if you do have a confirmed elevated PSA result for your age, we'll almost certainly refer you for a local MRI scan. And then finally, referrals to a local urologist. So if you've been referred in for an MRI scan and your MRI scan shows something abnormal, you'd usually be called to see someone like myself, where we can assess your symptoms, review your MRI results, and maybe consider a biopsy of your prostate if your MRI scan is suspicious. So the process is a bit like peeling the layers of an onion. So we go through each layer individually until we get to a final diagnosis at the end. Even if we were to find prostate cancer, there are a number of different options available. In many cases, prostate cancer can be quite slow growing, so we can potentially offer you surveillance. If your prostate cancer is slightly more aggressive, we may be able to offer you surgery or even radiotherapy. But at that point, we'll look at all the available options for you, and your treatment will be individualized for you. If fear of a prostate cancer diagnosis has been stopping you getting checked, then this message is for you. When we talk about early detection, what we're really talking about is getting an early diagnosis so we have all the potential options available to us at an early stage. Okay, so here's why that matters. The earlier a serious problem is identified, the more options we have. Treatment decisions can be more controlled and personalised, and outcomes are of course much better before the disease has spread. So I often say to patients that early diagnosis is not a commitment to bad news, it's a commitment to being informed. If you're wondering what practical next steps to take, I think the following is a sensible approach. So firstly, know your age and know what your risk level is. Secondly, get an idea of what your family history is, particularly in relation to prostate, breast and ovarian cancer. Thirdly, book a conversation with a qualified GP or even a local urologist. Ask your doctor if a PSA test is appropriate for you, and don't ignore any persistent urinary symptoms that you might have. As I mentioned, this is not about creating fear, but it's about replacing fear with actual knowledge. So if there's one thing I want you to take away from this video, it's that early prostate cancer diagnosis is not about creating panic. It's about awareness, timing, and giving yourself the best possible chance for early detection, therefore meaning all options are available to you. A PSA test is not perfect, but it can be used as a really useful starting point in the correct context. If this video has helped you understand prostate cancer diagnosis more clearly, then please subscribe for more content like this. If you're local to Manchester and would like to book a consultation with me, you can please follow the link in the bio.